Hello, everyone. Welcome to week 12. I took care of my patient last week. My patient is a 25-year-old Caucasian female. She came to the office that day for a crisis visit. She was scheduled to come later on during the month, but she was having anxiety at work, so she called and she was able to come in early. Patient stressors are she's a nurse. She has been working long 12-hour shifts for 15 days without day off. And then she said they have been doing primary care for 15 patients, a nurse. So she feels very stressed. She feels like she's not giving the care that she needs to give. So she feels inadequate because she doesn't feel safe, she doesn't feel safe. So that's her stressor. Okay, little background on my patient. She's the oldest of 6 children. She says that she grew up in a healthy environment. She had a good childhood. She is close to her parents, her siblings, and few of her cousins. She says she's a loner, but she's okay with it. All right, now we'll go to the before we go to the mental status exam, patient home medications. Currently, she's on lamotrigine or Lamento, 200 milligram BID, Boost by 5 milligram TID. That all the medications she's on. And we'll go to the mental status exam. Patient is well groomed. She look appropriately dressed. She described her mood as stress. Her affect is bright upon approach. She said she admitted to some depression at times. She denied mania, anxiety. She said she gets anxious at work sometimes when she's overworked. And sometimes she feels like having heart palpitation. She denied hallucination or delusion. She said her temper has been under control. Her memory is intact. Speech is concrete. And she oriented times 3. She had good insights because she took a time to come in when she knew that she was in trouble with her emotions. She denied she denied suicidal thought or any intent to hurt herself. For sleep, she said her sleep had been really good because after the 12 hours, when she comes home, she just sleeps or go to sleep until the next day time, and she get up and go to work. She said she had been eating on the go. She had not been eating fruits and vegetables like she needs to because she doesn't have time. For activities, she's just been walking. Her activities is walking up and down the floor, taking care of her patients. Okay, now we'll go to the DSM-5 axis. Axis 1, patient has major depressive disorder. My nurse practitioner, I've been seeing her now for 2 years. Well, I would defer axis 2. Axis 3, I would defer no medical issue. Axis 4, the psychosocial environmental factors, patient is doing good. She's happily married. She has been married for 2 years. She close to her siblings and her parents. Again, she close to a few of her cousins, and she hangs out with the girls at work at times. She doesn't have many friends outside of that, but it's okay. It's not causing any trouble. Okay, axis 5, the global assessment functioning, I'll give patient 92. She's doing really good. Besides her stress, which she seems to be on top of, she's doing well. Okay, what would be my different diagnosis for this patient? My different diagnosis for her would be caregiver role strain, as evidenced by overworked and has been working 12-hour shifts for the last 15 days. Okay, what would be my plan for this patient? Our plan would be to continue the Lamento 200 milligram BID. Would discontinue the Boost by 5 and start new order for Boost by 15 milligram TID for anxiety. And we'll also add a new order for hydralazine 25 milligram PRN for anxiety. My references are the AAP American Psychiatrists Association 2013 and STOR's Prescriber Guide 2021. Thank you.